Hey, is it possible to speed run recording a podcast, editing it, and while also having COVID and other stuff? We'll find out. Roll the intro. Hi, I'm your host, Kimberly Thomas Tagg, and you're listening to Signalize, a Dazzle for Rare podcast. Whether you're a patient, advocate, caregiver, or a clinician, Signalize is your source for good news, personal stories, events, and the things that rare and associated communities care about. Follow Signalize and Dazzle for Rare at DAZZLE, the number 4, RARE on Facebook, Instagram, and Twitter, where we'll post episode links, updates, and more. So, in October, in the last episode, my co-host, KimboBot5000, went through all of the awareness dates for October. There may be some more dates that I'm adding, so like I said, if you're not on the two calendars, you can also find them on the website. You don't have to subscribe if you don't want to, if you just want to occasionally check them. They're on Dazzle, the number 4, rare.net, and they're right there in the top menu. It's also mobile and tablet friendly, the website. So one of the new things that I have added was National Disability Employment Awareness Month in the United States. According to the US.gov, observed each October, National Disability Employment Awareness Month, or NDEAM, celebrates the contributions of America's workers with disabilities past, present, and showcases supportive, inclusive employment policies and practices that benefit employers and employees. ODEP has chosen Advancing Access and Equity as the theme for 2023. Many of you know that this is Lafora Disease Awareness Month. According to Chelsea Hope Foundation, Lafora disease is a neurodegenerative rare disease affecting children. Symptom onset is around puberty and includes epilepsy, childhood dementia, ataxia, difficulty talking, walking, and eating. It's a genetic condition. According to Chelsea Hope Foundation, there is hope. We're thrilled to share that there has been a new ICD-10 diagnostic code added for Lafora disease, and it will be effective as of October 1st. Lafora includes progressive myoclonic epilepsy, and so the code for that is G40C. Anyhow, the folks at Chelsea Hope Foundation urge everyone, if they're affected by Lafora body disease, and make note of the new ICD-10 code as well as the designation for myoclonic epilepsy associated with Lafora, which is G40C. They've asked for people to help share the information, and we're happy to do so. And there will be a link in the show notes. We want to hear your good news. We really do. And now more than ever, I feel like we need it. We have Danielle from Danielle Elevates, who participated in Dazzle for Rare 2023 this past summer. Her good news that she recently shared is that she's been given a fantastic opportunity to grow her leadership skills via Creative Ladder org. Creative Ladder helps to make industries more inclusive and accessible by connecting them with folks with a fresh take on equality and accessibility in the workplace. And what a better time than U.S. Disability Awareness Month, which is this month in October. So great that this news coincides. We're very happy for Danielle from Danielle Elevates. We'll drop a link to her Instagram. Masagwa Woman is named First Invisible Illness, But You Look Good award winner. This happened in September. The Invisible Disabilities Association, IDA, has selected Lauren from Masagwa as the first ever Canadian recipient of the But You Look Good Inspiration Award at the 16th Annual Awards Ceremony, and there is a fundraiser taking place virtually on October 21st of 2023. I think it's the 21st until the 27th. We will drop a link to her Instagram in the show notes so you can find out more information about her good news. Also, our Dazzle for Rare Network friends from Genetic Overgrowth PI3K Support are partnering with CRDN, that's the Cambridge Rare Disease Network, for RareFest 2023, and the event takes place tomorrow, Thursday, the 12th of October, in Cambridgeshire. If you don't know, the CRDN puts on RareFest every October. During the pandemic, it was virtual, but the last year and this year, it will be in person. So tickets are probably sold out, but we hope that folks have a great time at the event, which will be taking place at the Wellcome Genome Campus Conference Center in Cambridgeshire. Keeping with our friends, they're having a family fun day, which is coming up next month. If you follow their socials, keep an eye out for that family fun event that's happening in November. Other good news we have is there is new research out that explores a biomarker for acquired epilepsies. We'll drop a link to that as well. The NIHR outcomes have been published. There are new outcomes framework for defining key areas of health and care research. We will drop a link to that as well, as I know that'll be interesting to many of you. Congratulations to Dazzle for Rare Friends. ACMCRN proudly joins forces with Luna PBC, a public benefit corporation, and Genetic Alliance, a nonprofit organization, to launch the groundbreaking arachnoiditis patient registry. And of course, we will drop a link in the show notes if you are a member of the arachnoiditis patient community online, or you would like to learn more about their registry, which is very exciting. We're always really excited when one of our friends in the Dazzle for a network starts a new registry. If you want to hear more about starting a registry, go to our first guest episode with Sam Fillingham of the Pullman Syndrome Support Community. She talks about registry creation, and also our conversation with Lee Reevy. We also talk about creating a patient registry, so I definitely recommend those 2 episodes. Rare Voices Australia has a new Rare portal. Rare Voices AU have added a Rare portal, or a repository, if you will, for rare disease information and resources, which is great. We love to see it. What differentiates their portal or knowledge base from Global Genes, Genetic Alliance, and other organizations is that it is specific to Australia. And again, we love to see it. If you're a listener listening to this podcast from Australia, please go and check it out. And we'd love to hear what you think about the Rare Voices Australia portal. So while there's so much more I could say in this episode, I'm going to go ahead and leave it here, guys. I know it's a short episode, but I'm pretty exhausted from the last few weeks. And today is not, the day of recording has not really been the absolute best day, but that's okay. That happens. But really what I want to send you away with today, when you hear this episode, whether it's on a Wednesday or whenever you get a chance, it really is helpful to us if you not only like our posts on social media, comment on the podcast, subscribe to our YouTube channel where we have audio versions of the podcast there as well, which you can listen to on your mobile phone, tablet, computer, wherever you can use YouTube, basically. And also just share these episodes if things like awareness days are important to you. Free resources provided to the community like the awareness events calendar and the community events calendar. A lot of times when I'm on calls with other patients or other groups, folks will often say, gosh, I only wish we had a calendar that had different conferences on it, because that would really be helpful to a lot of us. And I'm like, hey, that exists. It's existed for a couple of years now. Please subscribe and help add to the conference calendar, because that's a thing that people do use. Or do sometimes need having a resource like that. And if we can maintain that together, that's just an added free resource to all of us, not just to one community, not just to one person, but every single one of us. The same goes for the Awareness Days calendar. We put Awareness Days on there for you guys, which we mentioned here in the podcast. And if we miss yours, trust me, we're doing our best. Most of the time, it's just me. And so I would really appreciate for folks, if you're listening and you come up on an awareness day that's not on the calendar or something's wrong or anything, please feel free to subscribe to the calendar, make a correction, reach out to me. Let me know if there's something I can add for you or if you need help. I've tried to make it as easy as possible on the website. If you go to the page that says add a calendar, there's 2 buttons you can click on for each calendar, one for each calendar, and it'll ask you how you want to subscribe. It's pretty easy, kind of buggy, but again, it's just me, and I can't do everything. I'm definitely not a WordPress whiz, but so if you enjoy this podcast, if you enjoy having a TLDR a TLDR recap of what's going on in our communities, what's going on in news, the conferences that are coming up, the good news, the bad news, or you just enjoy some of the things that I share here with you, or even the conversations I'm fortunate enough to bring to you, like those with Sam Fillingham and with Lee Reevy and with Daniel DeFabio and all the fantastic people in our communities that I'm able to share with you. If that means something to you and it's something that you want to keep going, please engage with us to let other people know that we're out there, because people can't know about these free services that we have offered now for some of them for years, unless folks are willing to share that information with others. And we're here to also share your good news, your events, your stories. And sometimes all you have to do is just send an email or just reply on social media, when we comment on things, or, reach out to me via email. It's just that simple, and I hope that you'll take the time to engage with us. We could really use that. Not because we don't make any money. All of this comes out of pocket. We don't get any funding. We do this, and I have done this for over 8 years now, as part of a package of public services that I offer. And I can't do it forever. And I don't want to take your money. What I do want, though, is if you could share and like and engage with us, that would really help. And if it helps your community to share this stuff, then please let us know. Thanks so much for your time, and I'll let you get back to your wonderful Wednesday or whatever time it is, wherever you are in the world. Have a great day. Thanks for listening to this week's episode of Signalize, a Dazzle for Air podcast. To stay up to date on the podcast and Dazzle for Air, follow us on Facebook, Instagram, and Twitter at DAZZLE, 4, RARE, RARE. And finally, if you liked this episode, share it with a friend and tag us on social media platforms.